Hello, it's Dr. Rhonda Johnson. Today is Friday, August 12th, 2022, and today I'm going to be talking about Omicron BA4.6. Well, if you remember, we first had Omicron BA1, then BA2, then BA2.12.2, BA4. We're still in BA5 with over 87% of COVID sequences in the United States showing BA5. Now the CDC has named BA4.6 a variant of concern here in the United States. And you know, folks, I don't like this Omicron family. I like to think of them as unwanted and uninvited family guests. But it looks like BA4 is coming in fast. It's gaining traction in the Midwest. In states like Iowa, Kansas, Missouri, Nebraska, it's showing up in over 13% of sequence specimens. And it's moving east, and globally it's sweeping through Australia right now. Now, health officials are bracing for a possible spike after school starts, and a lot of schools are already started, and the young people are going back to college. But according to the American Academy of Pediatrics, let me get that right, the number of COVID cases in children last week grew for the fourth consecutive week, and over 97,000 cases were reported for the week ending in August 4th, and kids' illnesses are also trending upward. Now, what are the symptoms of BA4.6? Experts are saying it'll behave clinically like BA4, with fever or chills, sore throat, runny nose, headache, cough, fatigue, nasal congestion, muscle or body aches, headache, new loss of taste or smell, nausea, vomiting, diarrhea, and shortness of breath or difficulty breathing if it becomes more severe. So how do we protect ourselves? Again, we saw this week that most, even the CDC guidelines and recommendations are gone. Most local and public health and state departments have just given up. You know, Americans value their individualism. They value their personal freedom. They don't like being told what to do. They've resisted mandates. So we're on our own, folks. Here we are. So remember, the people most at risk are, the young, the very old, people over 65, babies. Pregnant women are especially at high risk for COVID complications. People who are immunosuppressed for many reasons. People with multiple chronic conditions. Folks, please continue to exercise caution. We are still losing at least 475 people every day. And in a month's time, that's at least 14,000 people dying of COVID. That is someone's family member. The 14,000 family members dying of COVID every month here in the United States. Now, what we have to remember is that we can get reinfected multiple times. And for many people, COVID is not the cold or the flu. And neither the cold or flu will give you long COVID. So what do? Remember the layers of prevention. Our vaccines and boosters. Antiviral therapy. That's the monoclonal antibodies and Paxlovid for those who are eligible. Masks, washing hands, opening up the windows, doing things outside, putting air filters and fans in your home. And don't forget the basics, eating a healthy diet, getting enough sleep, avoiding alcohol, tobacco, street drugs. Take a multivitamin and mineral supplement appropriate for your age. Get regular physical activity. That's what we can do to keep ourselves in good health. That's my message today. Please take care of yourself, be well, and I'll see you next week.